mani padme hum. Om 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 mani padme hum. Mani padme hum. Mani padme hum. Mani padme.
All right. Good evening, everyone. Thank you all.
Hi, good evening.
Hi, welcome everyone. Thank you for joining. I am Yeralix Estrada from the New York City Department of Health and Mental Hygiene.
nga Yeralix Estrada yin ngara New York 최대 다 semcam 최대 땡칸에 yin.
And we're co-hosting with the Endangered Language Alliance and the Tibetan community of New York and New Jersey for today's event.
하링 안소 잠링케이 숨겹 초바 World Endangered Language Alliance 냠룩톤에 고디 슈기유.
This webinar is part of a series of webinars with many community interpreters for a variety of indigenous languages.
자게 레첸디 치소 드라민 기케리 토 케귤 균에 슈기유.
This evening, we will have live interpretation to Tibetan, and in future conversations, we will have other languages.
할랭 공도 레첸디 그게도 그게요 대신 마음 버르기리 신도양유.
We are excited to bring you all together to discuss the critical issue of the COVID-19 vaccines.
안저 가보간에 또 내공고기 갑기골 둘랭 슈기유.
I know we all have a lot of questions, and hopefully we will have the opportunity to speak to many of your concerns today.
Number 2, 독티 망보 여방의 시기유 대신 랜뎁 투바 레와유.
That way, everyone can make an informed decision about the vaccines.
대규내 공고 갑견규 타주 라 개발용에.
I would like to introduce you to our Tibetan interpreters from the Tibetan community of New York and New Jersey, Sonam Tengang and Yeshi Jimeg Dangme. They will
예 개귤 넘버니 소남 땡강당 이시 직매니 모두 슈기유.
They will introduce themselves. They will introduce themselves in English and in their native language, Tibetan.
공익이 인계당 벽에도 모두 슈기래. Hello everyone, I'm Sonam Tengang, Health Coordinator of Tibetan Community New York and New Jersey. Thank you.
Hello, my name is Yeshi Jingme, and I'm the Vice President of Tibetan Community of New York and New Jersey. I'm Malaysian Jimmy Lagyo, not in the New York and New Jersey politics open so
Thank you, Sonam and Yeshi. We acknowledge that this past year has been especially stressful and painful.
I'm sorry. Wait a minute. 국제체낭 소남당 이시니라 델르낭 강에 가츠여 최여바 나츠시기여
The loss of loved ones, jobs, businesses, homes, and livelihoods has been an enormous weight for us all.
미시냥엔 레쇼와 총구중과 속 강에 태바 양식이여
Many of you have also suffered from years of lack of access to important resources.
남버초라 디데다 로망사베 귤라 경구다 맨주기 튼줄라 강에 태바 양식이여
These experiences have reinforced cycles of trauma and created a lack of trust towards government and healthcare.
네타 데타르라 떼네 강다다 퉁에기 오네 슝다 최대 생각 월 델람 양 신두 양 규르여
We feel compassion for those who have historically or personally experienced discriminatory treatment.
ngansu chiger sunda shigla menjuigi tunge 준배 tuba la semsoryu
The work we are doing to educate and gather information for the community on vaccination is keeping these important truths in mind.
ngansu lecher di chicho le ngongkapgi nensu kodupdang dogo godo pelchein
We are not here to convince or force anyone to get the vaccines.
ngansu dir ngongkap gyabe nenshu che soki che dumen wen kyang
But we want to provide all community members with the most up-to-date scientific information so that everyone can make an informed decision about their body, whether they choose to get the vaccine or not.
wen kyang chendengi godo pelte rangta chwa che duin
I want to set and share some community agreements to ensure a productive discussion.
lecher di tone chisogi chuchu ashegi chisogi penu yongwar che du toleng chagyuin
The first is respect everyone's opinions and concerns.
당보 강사 소수 철와당 삼주라 구지유
Everyone's experience is valid, and we want to respect everyone's concerns tonight.
창매 용화당 용화남 외바당 철와라 구지유
And the second is please speak one person at a time and do not interrupt anyone.
이와 까면 난갑 미레레네 낭로 상감마규로 낭
Everyone will be on silent, so use the Zoom reactions to raise your hand if you have a question.
창마 쿠셈 슈로 낭 지와 난갑 수 차경로 낭
Everyone can also put their questions in the chat.
창매 짝낭 지와 진낭낭 딕
And if you're watching from Facebook Live, you can share your questions in the comments of the video.
ngode 태동 페이스북 라이브 내 시기 유바이나 comments 낭 지와 진낭 딕
Today, we want to share with you what we know about the vaccine and answer any questions you may have.
다링 만주 ngongkapkor kang sheto yobate pegyutang tiwar lendep shugyuin
I want to introduce you to Angela Soto, Director of Health Promotion at the Department of Health, and to Dr. Flores, a doctor from Health and Hospitals.
다링 최대 겐지 앤젤로 소토 기 ngongkapki sungyop lamde naminto sungire
We are all here to answer your questions.
대양 마체 최대menkan health hospital 내 Dr. Flores 양 된저 슈유 아니 먼저 딜 캐남기 도과탄 티와라 렌뎁 렌뎁 난기레.
And with that, I will pass it on to Angela to start the presentation. Thank you.
대단 찹직 콩 넘버 남 Angelo Soto 라 표기인 토차남.
Thank you, Yerelis, and thank you, Sonam. I will begin by sharing my screen. Give me one moment. Perfect. Can I just get a heads up that you can see the screen?
Yep.
Perfect. Thank you. Thank you everyone for joining us this evening. I'm excited to have the opportunity to speak about the COVID-19 vaccines.
미슐라.
라서 타말로 토친 나스진 슈야다 아트니 단다 코비난 또임니 니렘 주궁오고 민캅된 데비 토니 오토 토친 슈야레.
And as we continue to learn about the vaccines, we will continue to provide guidance and information to all of our community partners and all of our community members.
단다 ke lerem de chita 뉴욕 ke ngadi hotel le konta antiga na je semkan hotel le konni chiloni don yustaki lo chinda trupi sepachudo ni to chin kode shuja wachi chagdo da ke ane kode che ande ke mapuche la to yem na cha ke ngogo ke kapten rebi ke shija mapuche to chin rewa shu de to chagdo.
I will begin by sharing what vaccines are currently available to all New York City residents and anyone who lives in the United States.
Tambo tamshin go tsuya te New York tonjek da New York ngadi kna la an to ye nirem chugu ke ngogo ke kap kar kare an ngaran sola raya yobi kol to chin shugi.
Great. So thank you, Yeshi. So we have 3 vaccines that are currently issued emergency use authorization by the Food and Drug Administration, and they are Pfizer, Moderna, and Johnson & Johnson, also known as Janssen.
Tanda nga tso arinal yobi ke zacha tang menzi to dam de kong ke ngoni zara nga la peju tang ya ke chumche ti jan yo ke to yem na tsa chugu te la ngogo ke kap som to chin yores ke ante tambo de Pfizer lo great ni Moderna se ke anti ga na ji Johnson yamina Janssen se ke kap number mera wa som to chin yores.
In issuing the emergency use authorization, also known as the EUA, it was determined that the evidence showed that the benefits of the vaccine strongly outweighed the risks related to a COVID-19 infection for all individuals that got sick or could become sick with COVID-19.
Tanda ari ke zacha tang menze zo chong khang ke todam le ko ni ane chi takji de simjo ramba chibi ke pangda chenbu yobi ke thoni antren ke ngogo ke mikam de jabi na pento chenbu yobi ke kol to chin ne pa changmal zo chin pento chenbu chagi yobi ke kol to chin shya yinske.
It was for this reason that an emergency use authorization was granted for all 3 of the vaccines, even though it was granted for Pfizer first, then Moderna, and then Johnson & Johnson.
Tanda zada ke kap number som te ane peju tang choya ke chomche to chi top de yore te tangpo Pfizer se de chomche top re niba Moderna se de chomche top yore anen tamate la Johnson dan Janssen se de peju tang ya ke country de chomche top de yore.
It is important to note that no shortcuts were taken. I'll repeat it, Yeshi. It is important to note that no shortcuts were taken when in granting an emergency use authorization by the FDA. Should I repeat it?
Sorry, from the form is corrupted.
Yeah. Oh, I can repeat what I said.
I can't wait. I can't see you right now. Where's that thing? Okay, sorry.
It's okay. I'll repeat what I said. It is important to note that no shortcuts were taken when the vaccines in this granting of the emergency use authorization or EUA.
Tanda nga tsuke zadak thoni ngogo proske ne chomche nang yawate nga tsuke ane chik ta jaya ka tuje de chasan lo yu de cha ga do tonda do ro chiwi.
And soon all three manufacturers are expected to apply for a full approval or license once people in the trials have been followed for a longer period of time.
Tanda menze me ka manda wa som cha de wa te ke zotu kan sama lo ke ta chi kangjo chinjo ke ane pejo tang choya ke chomche tang ai cha cha ra ya to kine rewa chi de kine tang to kine rejas.
And apologies for this information here because it says Pfizer has applied for license for people 16 and older, when in reality, Pfizer has been granted the license for people 12 years of age and older.
Tanda de la an thwa ro de Pfizer se ke to yu ngo ke khap de lo chudo ke kang la jaya ke chomche to yore chin song yore te tonda ngu bu ke chani lo chungni le gebi ke ma chatan lo to chin jaya ke chomche nyam du top de gores.
So briefly, I'll cover how COVID-19 vaccines work.
Ta to yeb ni rem chugu ngo ke men kam de ke chin ni ba ro kan ris thong yu mi kol shubi nas.
So Pfizer and Moderna are known as messenger RNA vaccines.
The Pfizer said the Moderna said ni ta tanda test che men kan ke check de test do tonda do ro chewi na ane longo sumchu ran la to kene choda chene tamatela ane Pfizer de Moderna said ni tablam saba chi de chetap saba chi le ten zu jen jo ke men kam ni chago sare.
While it is a new technology for vaccines, it is not an unknown technology because it's been studied for over 30 years.
Tanda Pfizer de Moderna said ni ke tini te ane laksa saba tang tablam saba le ten zu jen jo chi re te yin yang ane tablam te ke chi rimba ro de sibi na lo sumchu se ran la to kini men zoya la so be nyamnyo yu de bi ni tanto kini yores.
The vaccines do not contain the virus, but instead they contain the protein from the little spikes on the coronavirus.
Tada te ngogo makeup to chuk na la virus tende yo mare te yimbi ne yang to yim yin rem chugu ke rgyun ro te chek ti ke makeup ti na la yosare.
The Johnson & Johnson, also known as the Janssen vaccine, it is a known technology or a known platform called adenovirus vector vaccine.
Johnson said the adenovirus vaccine to kine chag yores tati na the makeup te so namje junde ne ngaran chu ke chambri ngogo che ya ke ane me da nyam tin tawa yu de bitin na to cha usare.
This technology uses the adenovirus, also known as the common cold virus, to deliver the COVID-19 protein into the body.
Tanda adenovirus said the ta kole ro chi na chi tang ke nam ju nga chun chamre ke na ta ko ro de che ke dandewa cha de yo wa tan te ke ngaran chu zu pu ke na la ta chi ju ro de che nyam ju le bi ke thoni ani me me de ke ni ba thon ya ke che pa ro yo bi zo ro stre.
And similar to the mRNA vaccines, the adenovirus is modified to not cause the disease, but give the instructions to our bodies so that our bodies produce the antibodies or the protection to respond whenever exposed to COVID-19 or SARS-CoV-2 virus.
Tanda adenovirus se ke zunjo ke tanda te Johnson se te chidan china njuwa chimba ro tangwi ke thoni di ke menkap te ke nasa tindi luya ke chin tindi che ge yo mare se lakbar to di ke nuba te ke ane covid tanda toyem nasa chugui na re star inare di nasatini la kayake chechu the nubato dingores.
Thank you, Yeshi. The take-home message from this slide is that for all three of the vaccines, none of them contain the SARS-CoV-2 virus or the virus that causes COVID-19 and cannot cause a COVID-19 infection.
Tanda ta domro jawi na tingu ko kap sunga lo te ke ane pinu do te la kanta toyem na tango macho wa ta mango wa ke tole nubat chempo tongo yores.
So let's talk a little bit about how well the vaccines that we currently have on hand work.
Ta tini tigi nyamdu la tanda shep jeb shuwi na tanda ngaran su toyeb ki ngogo kap yu de wat ke an nuba ya hiro kan dis tongo yores chini shuwi na.
Thank you. In the clinical trials, all three of the vaccines were shown to be
tanda nga tsu ke ta tsoti kan simjo chiwa na ji chene ngogo kap manda wa som te ke nuba ro kan dis tongo yores labina.
they were shown to be safe and effective across all gender, age, race, and ethnicity groups.
Tadi kapsunga lo te ke nubado te pomo tan lona tan reg tan rula sobat de ke cheba me big thoni changma lo te la denja tan antiga na je ke pinu thongu yowate ane hakogu yores.
And they were shown to be very effective at preventing severe COVID-19 illness, hospitalizations, and death related to COVID-19 illness.
Tini te de nyamdu la tan ti ke karton tu gores la vina ta don to yeb na sa chugu ke chen chen ne ane ne pa chawa ta me khan ni gu wa tan chechon chunga la sobat so la ane ngo yunya ke ni ba chembo thongu yowate hakogu yores.
And because in the United States, we have hundreds of millions of individuals, not just in the United States, but certainly in the United States, in Canada and other countries, we have real data, real world data showing that Pfizer and Moderna vaccines in the general population are very effective at preventing severe COVID-19 related illness.
Tanda ari nang chaja winere Canada nang chaja winere musaya da saya tindiki nani ane Pfizer da Moderna se ke ngogo menkap tini ke nuba chembo tongu yowate ane hako tugu yores.
That is important information to not just celebrate, but to know that in our hands, available today, at any moment, even tomorrow, we have a tool that could prevent COVID-19 related infections, hospitalizations, and death.
Tini tida nyamdula tanda COVID-19 ke togem na sa chugo da chinche wi ke Nepal la sobatinde nyondun roya la sobatinde ke pinu chembo tongu yobi ke ane pangda de jumse yowa che tak ngeti nyamdu tele utes cha song de kanta do dunu shuwi na ane tanda kap de zola pinu chembo yobi ke ane pangda tang icha toskine sebo tenga yowa chagadu.
So let's talk about who can get vaccinated now.
Da shewi na ane ngogo ke men kap so suti to go labina.
So people of all ages, starting at the age of 12 years old and older, can get a vaccine in many locations throughout New York City.
Tanda te kodan des norisha ane ta solo ngogo men kap te ragu yoris labina. Lo chungi le gembi ke arina la denye ke machatan lo toksine ragu yores.
I think it's important, even though the slide says who live in the United States, we also welcome visitors to the United States.
Arina la denye chiku inare ta don arina la chetan ruju ki chitulende lep denjo yimbe ine yanga chu kap te jagu yores.
The important thing to note from the slide is that at the moment, individuals between the ages of 12 to 17 years of age can only get the Pfizer vaccine.
Tado ke cheshu che la sachendele yu dewe ke me lo chungi ni chubdun pala yin denjo ke machatan lo la ane Pfizer se te kap chiku toksine jagu yores.
The COVID-19 is at no cost to anyone who wants a COVID-19 vaccine. And if individuals have health insurance, an administrative fee or some type of co-payment can be charged to their health insurance, but otherwise, the vaccine, the COVID-19 vaccine is free.
Tanda ari nal chajawi na toye na sa chugu den rewi ke namju mekang roya yimbi na to chatsan lo te rimi chagori ra lakpar toye na sa chugu ku ngongo ke mekam de la chat sangwa to chine rimi to chine cha de gore yimbi na yang ane insurance yomi do wutin di ke je chungbi na yang te toda sosu nguni ane ti ki chashi zamya to chine je gogu yo mare changma lo te rimi rang phugu yo res.
COVID-19 vaccines are available to anyone regardless of immigration status, and it will not negatively affect individuals who are applying or in the process of applying for immigration status in the United States.
The ari nang ro cha jawi na toyem na sa chugun de ke ngogo ke mekam de machang lo lan thopang yu de wat ni chi cha go ri la lakpar to chi chilo ni le den jo ke me andele yi chak ni tang kan de yomi lo ma tu ba cha sang lo de kabra go res tiga na je kap te jabi ke chen chen ni ane so su ke andele yi cha shoya la so bat ni ke to la yang ane ni chu duat de dan kalo shukin ro ka ke tibge mare.
And when people arrive at our vaccination sites throughout the 5 boroughs, please know that your information, your privacy will be protected.
Ta tongche New York nal cha ja wina tongche cheba nga so ro ti kin nang la kap ja kalan robi kabla chuna ke kap ja bi ki chala so bat cha chan lo te denja dan sungcho byo res ya ante memang du la chabda che la so bat ndi ke so su ke ni chu te me jimba la tang ma res.
Why should we get vaccinated? Is the next slide.
Sorry.
Oh, why should we get vaccinated is the next slide. We'll cover that in the next slide.
Pari ni pati nang la nga so kharchi ne to ke ngogo khap de ja go gu yo res.
It is important to get vaccinated with the COVID-19 vaccine to prevent hospitalizations related to COVID-19.
Toyem ngogo ke khap ja de ke gu ba dim che to do te toyem na sa chen che dina an so so me kan nan roya la so bat cha san lo te kango chi thu gu yo res.
It is important to get vaccinated with COVID-19 vaccine because it reduces complications related to a COVID-19 infection.
Atiga na je toyem nyerem chugu ke ngogo kham de jabal che ne toyem nyerem chugu den de ke to ni kange tang ta chikchonyo la so bat direct me wa cha gres.
And it is important to get vaccinated with the COVID-19 vaccine because it reduces the deaths related to a severe or a COVID-19 infection.
Tiga na je toyem nyerem chugu ngogo jawan de la ten an toyem nyerem chugu ke chen ne ching de don roya ke tang si te aman nyong don roya ke pinu thong yo res.
Getting vaccinated with the COVID-19 vaccine not only protects the individual that gets the vaccine or receives the vaccine, but it protects those around us, it protects our loved ones, and it protects our communities.
Toyem nyerem chugu ngogo kham de jawati sosu chikpu ke sungchop chi de chikpu mare es de ke sosu nyen kol yo de ke sosu ke nam tang antiga na je tomba chimchi la so bat cha chan lo ke denja tang tinjile phendo chingo res.
It also protects those individuals that at this moment cannot get vaccinated, such as the very young children, or individuals that have other maybe health-related reasons that cannot receive the vaccine. So by us getting vaccinated, we also protect those individuals, those community members around us, and people that we love.
Tanda toyem nyerem chugu ngoko kap jawan de kita sosu chikpu mai bechine kanda sosu nyen kolo yowa lakpar de ndokcha jawina tanda lo chungni ke kan to sol khap jage ore te lo chungni ke o to sol khap jage me wa song san ti ke chipa la so ba antiga na chen che zukun choten ke wang ke chi tanda khap jam jaya ke neba mi denjo kre la so ba te chasan lo ke denja la ane pento yungu ores.
And getting us vaccinated, or getting everyone vaccinated, as we are seeing day to day as our city opens up, gets us closer to ending this COVID-19 public health emergency worldwide.
다 단단가 주기 갑되면 차상 야톱된 제비나 안에 동체 제용이 또 이건 거 요바다 라바도 잡을 제용이 곤체네 또 지금 참말로 된가 주나지게 안에 안소바지야 유대비기네 단차고 요레스.
So what can we do to get ourselves vaccinated and the people we love vaccinated?
다가 응고 기면 갑대 가와니 자가게 투체 라기 요레스 라비나.
So if you've gotten vaccinated, thank you. And if you are trying or looking for appointments or places to get individuals that you know or that you love vaccinated, you can find that information at nyc.gov vaccine finder.
다 소소이 갑자고 있는데 소수게 남의 분자 안에 라바트 제 안드바 연조든지 갑자든지 지고그 여비나 안에 갑자사 가완도 제약게 치돌라 안에 가와 페고레스라비나 nyc.gov.vaccinefinders 에티라 페비나 안에 라그레스 갑자사 가와 유미티.
Most sites have walk-up services or services where you don't need an appointment. You could just walk in and receive your vaccine.
갑자스게 산에 망보지 때다 소수게 냥고 콤파자네 리비아 요게 사자든지 차데게 요리라 투제 자자 요리라 안 라버도 지 응오니 뒤주소 안들이 지를 용기 뒤주테로 지실라에티 묵세 보야게 요 말에 안티가나제게 뒤주로 지 주비나양 트렌존에 트렌랑라야게 투제야 토스킨 요레스.
There are many locations that offer the vaccine, including
1 minute, please. My door is knocking.
Sure.
Sorry.
It's okay, Yoshi. Thank you. Yeah, there are many local pharmacies and big box pharmacies like Walgreens, CVS, Rite Aid that offer the vaccine. I know CVS offers walk-in appointments. You don't need I shouldn't call it walk-in appointments. You can just walk in. You don't need an appointment at CVS pharmacy. So there are many, many places where we can get our vaccines.
다다다 또임니레 주구게 ngogoke kapte chonyala tujeta sacha kasakala tostine jajauril habarto chik sosu mekan yibinare tiganaji ane ni yonyolo yo debeke me sonsa rek thamalo tostine tunjete jajayores habarto ta me sonsa rek chek nalangaran so CBS yo CBS rawtinde yimbina ane appointment de gulo maril shaja chine me kapte janande gores.
And for individuals that need assistance, meaning like a ride or transportation to and from a vaccine site, you can call 877-829-4692 to set up transportation to and from the location. So from your home address to the vaccine site and back to your home address.
Tini kanza chedra pasuyo rongwa tindi chela yanche ngogo ke kapte jaga landroya ke chitro chuche koya ro tindi yimbi ina ani tanda ji dun ji nigo jetro nigo thola shiba chone dewa chebi ina ani kona bake sosu nani makeup jasa ke sachatela pha dinde shyo ani tiga na ji makeup jat sabi ki jela makeup jasa tini yang sosu nang so dinde shyo ala so batini kuche jago yores.
And for individuals that cannot leave their home to receive a vaccine because of mobility or because of age or any reason, health-related reason, you can call the number I just said, 877-829-4692 to arrange for an at-home vaccination, or you can fill out the form online to receive your vaccine at home.
Tiga naje ta kanza chedra ba tinde kanya rwa tinde che yang khapja kala chuni phandro thubya ne ta mejo tinde yimbi na tanda konti shubiki khapa anda ji dun ju ji ni go jetro go ni ke thola to kine dewa chene ne ta ta shubi ne ya shubi na an khapja ni ke me ta me bala na rin me jamala win re tinde 소수 나라 용의 도끼네 갑자기 투쟁야 도끼네 자기요래 안테 자가라 담보 가바다나 그래 대매비나 어디니 단다티 폼쇼제 장야요래 기 폼쇼제 장미나 안드기요레스.
The next slide shows a caption of our vaccine finder, our nyc.gov vaccine finder, where you can go and find a vaccine or the nearest location for your vaccine, rather.
다 재미있게 단다티 파쇼 토야티나 라 뉴욕 총재께 나라 또예 니렘 투고고 카테 가와카와니 라게 요미탄 안에 사자 가와레 투제티 요미토 킨데 제야키 포트레스.
And I'll walk us through some of the important things to note when you arrive at this website address.
담보데 다 참말로 개체주대 사전데 소수기 공파자는 로트베요 간다 소수기 이용랑 또 지네 제약 다시 제위나 아니 담보 다잔들 야펩 어또 지네 아니 제야요레스.
So for example, you can put your zip code or your address, or you can click on this little icon. If you don't know where you're currently at, you can click on that little icon and it'll zone in on where you are and find the nearest location near you.
단데 제비케 갑라 담보된 소셜 제사케 자세티나라 소수 가장당 안티가나진데 잠깐가 지비케 집코르세 제 요와테 잡난 되게요레 안라 양 카셰케 소수 가왈 요미케 가장 세보든데 하마고 버든데 임비나 단단데 search nearby lab진조 코워트나라 택진도와 고고진도와 디칸는 임비나 아니 소수케 가장 동화제 소수 가장 동사비케 예라 아니 예용라 또 영국에 갑디 가와가와니 라고 요미테양 통그레스.
This little icon over here at the far upper left-hand corner, you can select the top 13 languages that are provided by New York City Department of Health, or the city, rather, newyorkcity.gov, or you can also have Google translate if that language is available via Google.
dati yoncho ke thoma tenala ane kiye ki damsa toksini yore che tinala ki marawa sum sodan toksini yosare ane tinala mebi na sosu ke tini gugu ke igyo ke nyeche te peju chene yang zeya toksini yore kanta tinala ta toyem nyeren dan debi ke thoni shijatende mampoche ane ki marawa mampoche thoni yu debi te tini raya yore.
And you can also filter by type, vaccine type. So if you're looking for Pfizer for individuals 12 years of age, between 12 years of age and 17 or 12 years of age and older, you can filter by vaccine, and you can also filter based on locations that do not require an appointment.
Tiniti watine any vaccine says do ati kan la to chin shubi na and so kap karid of jangye trogyo beche pecha jana nga Pfizer jagin sila na Pfizer jaksa ke sachate so su yin la kawa yomi ta and kana je Moderna se jagina kawal jaya wa la ba to so su chi pu chung chung ro tin yobi na tanda kap chek ma to dam kam son san ti kap te so su ki kompa jane lepsa njo ke sacha tanye shu kawa kawal yomi te yang ani shito tugres.
Thank you. So what do we need in terms of eligibility or consent to receive any of the vaccines, Pfizer, Moderna, or Johnson & Johnson?
Ta toyem nyere chugu ke kap tanda yu dewa som Pfizer da Moderna da antigana ji Johnson se te som te tobia chitula che ye yang icha da wodan gungi chache do pare yo jubinas.
Everyone who's going to receive a vaccine in New York State will need to fill out the New York State vaccine attestation form that can be accessed via the link that you see here, vaccineform.health.ny.gov.
Tanda New York na la yu de nye ke kanta me chatsan lo la kap de jaya ke thotan dan thuje to kini cha de ke yore tende embason sa ane so su ke fonko de jambi na tanda de la traffic je yadwa vaccineform.health.ny.gov se ti tole pen ne an fonko de ne so ke jabi na kanta me changma la jaya ke thuje de jaya yore.
And for everyone, please bring proof of age. That's all you will need. You can bring a passport from the country of birth, any ID that is issued, NYC ID, just something that proves your age.
Kap jakala yungwi kala me chatang ke sotu ke lo tsu te katu yimba te seton che dan pangta yunga chitula ane 소주게 메세크 랑체 이나레 안티가나 제 첼로 제 임베 이나레 안테덴 레비케 토니치 NYC 뉴욕 책 지janjoke 차이나레 어떤지게 토니 간다 첼로 제 카사고 연jo도 신이 고비오레시 카르라나 안에 로출로 파피케 캅게 양케 예와다 담세케 야든지 요바손자 아니 로투딩에 바토 땡고게서라
Young adults or adolescents between the ages of 12 to 17 years of age that cannot prove or have something to prove the age, they should have parent or guardian attest for them. So that's important to note for younger adults between the ages of 12 to 17 years of age.
tatini ke cheshu che la chidam chama lo khabja ken thoptan den tuje yore te yimbi na yang lo chungni ni chubdun pa ke ta chi pas la ra chi pa yimbi na ane khabja kala yungwi kabla inchi mini ane phama yang mina phama ke to kine konga na ya ke ta to chinye la so ba ni nyam du yong an te de nyam du la ane lo ka so yimba te ke pangta te ngi pa nyam du na phek ko yore.
And that attestation or parent or guardian attestation can be done in person, especially depending on the age between 12 to 15, can or should be done in person, or it can also be done for those individuals 16 years of age and older, can be done by a phone call or by completing a consent form.
The Lochuni the Jonga Panda Wimbe na ane Shadana Libby Kabla Tokin from Jamna and Rigori and Lochuru to Ina font Kapaton to Sinian to Suzone Kapatana to Sin and Rigorest.
So up until now, we've talked about general information related to the vaccines. We'll talk a little bit about the Pfizer and Moderna, which require 2 doses.
Tanda Patula Natsuke Togib Natsate King Ogo Cup, Madawa Song Tony King to Chevre, that Tanda Chala, Ane Cup Ngoke Cup, Pfizer, Dan Moderna Nike, Ane Cup Nipati called to finish.
So with the Pfizer and Moderna, one receives or gets the full protection of the vaccines after the second dose, and then 2 weeks after the second dose is when we are fully protected using the Pfizer and Moderna vaccines.
The Captain Jab Savik Gilacheta, Captain Nupa Tongo Yorila, Harpart, Dunta Niki Jela, and the Captain Niki, Nupati Yeni, Zupinala, Leviathan, Mongochea, Yeni, Tontambi Mongochea, Nuparo Yeni Libu.
It's always good to get your second dose vaccine at the same place where you received your first dose, but now you can receive your second dose at any location, regardless of whether you received or where you received your first dose.
And Savik Chane, Cap Nipati Kawani Ragislana, Cap Tampo Jasasni, Ragake, the Yori, the Yimbi in the Yan Tandiki Channel Chivina, and the Cap Nipati Suzuki, Kawani Ragina, the Nish Natos in go rest.
The important thing to highlight is that the second dose of your vaccine has to be the same vaccine as your first dose. Meaning, if your first dose was Pfizer, your second dose has to be Pfizer. If your first dose was Moderna, your second dose has to be Moderna.
And the Nyamdula K. Chembuke Tolo Jaguya Kesoro de Careslavina, Cap Tampo, and the Ungo Kamara was some you de Tinani, Cap Tampo Carajabina, and Tike Kamnipatian, Capri Garan Jagre, Pechayana, Pfizer Cap Tampo Jabiovina, Kamnipati of Pfizer and Jagore, Cap Tampo de Moderna Javina, Kamnipati Moderna and Jagore, Tini de Pal Solo, Talitelito Chiniche Mare.
At most locations, they will also schedule your second dose for you. If you receive a Pfizer vaccine, they will schedule your appointment, your second dose appointment, 21 days or 3 weeks after receiving your first dose of Pfizer.
And the Gongo Cap Jasa such a Mampoche, Cap Tampo de Jakan Rovi Kabla, Cap Nipate, Kadu Jagayomi, Dan Sachakawa Jagayomi Tokin Kuzuke, Atuzo Yungore, Savik Chane, Cap Nipate, Cap Tampo Jamne, and Yeman, you should suck Yamina, and the Rason, the Jeki Tokin to take your rest.
for your Moderna vaccine, for those of us that receive a Moderna vaccine, you will receive, or you should receive your second dose of the Moderna vaccine 28 days or 4 weeks after receiving your first dose of the Moderna vaccine.
Kasi Moderna se ke ngogo ke kap de jang ke to yimbi na kap tang po de jat sabi ki je la nyama ni su tab ji yang mi na dun tha je ki je la to ne an kham ni ba te ja ga ki tu je ra go yores.
And it does say there that bring your proof of vaccination card, so the little vaccine card that you get when you receive your first dose. But even if you lost it, please just get your second dose. We will be able to find your information if you do not have, or if you lost or misplaced your vaccine card. The most important thing is to please get your second dose of the vaccine.
Tini te de nyam de la tanda sabi ke Pfizer yimbi na nyama ni sta ki je tang Moderna se ti na nyama ni sta ji ki je la to ne ja ge yore yimbi na nyama ni sta gu la ta ta ja go ya de yo ma re ti je la tu su ka du sun jo wa che ke tu su ko ka bra go na te du la to ne ja ga ti che ge yore ke te de nyam de la kap tang po ja yu ke kap la kap jam jo ke jing jing jang ro tu che nang ge yore an kap ni pa ja wi ka lan jing jang ding ji mi ni ku go ge yore ke ya kashi ke Xinjiang de labu yin ante da ke yo mare yin chi mini kamni ba de yin chi mini ane jat wa to ke naro nang.
And our Dr. Flores will talk a lot more about the common reactions or concerning reactions that our members or individuals in this presentation may have, but I will review some common reactions after receiving your COVID-19 vaccines.
Shamsa Dr. Flores ke ane to ye nyerem chugu ngogo kam de jawi ke chen chen ta snuro kar kare chagi yo wa tindi ke kola an to sin sugres.
Reactions are expected when you receive any vaccine. The COVID-19 vaccine is not is normal in that regard. It is I said it is expected to have reactions after any vaccine. COVID-19 vaccine is just one more of those vaccines that having a reaction after the vaccine is expected, or it's not unusual, rather. It is a sign that our bodies are building protection.
Ta chita khab sangma jawi ke jela che snu zoro chine tes ma de we dro chagat de yungo rila lagbar to yem nyerem chugu ke ngo khab de jawi kabla an tes ke ma de we ke ne tang ro de chag yore te cha goya ro de khar res la na an khab de ke ni ba zupu na la lep de che we kala zupu na la phejin ro tang de de ke wang ke an tes che so chong ro de tes yo wa ro de che la nguzi che hat de yungo res.
Some common reactions are soreness or swelling where the person received the vaccine, headaches, light body aches, tiredness, and fever. But all of these, or just some of these, will be very light.
Da chi yung ke sunu kuzoro cha jawi na ane jinguna jaga la soba tang ta kap jabyo wa song zang ane jing ngo na ina re ane zubu ma dewa chago na re ane te che tang chin joro chago yobi na re yang mina cawa ro jago yobi na re tende te tende yungu yo re te chatang yungu ya tende ke yo mar di ki re tende kashi kashi yang to sin yung sewa ro to chago yo re.
And they usually start within hours and to the first 3 days after getting the vaccine. And they usually last, if you do have any of the reactions, about 1 to 2 days. And they are less common among older adults.
Chitang tanda sunu ke ngong tang rawo te donya rawo te chitang khab jabi ke chusu che ke nanga thong sewa to chag yore la yimbi na tadong yang nima che ni nima som ke partula to ke na yang che zupu ke na la khab jabi ke nipa lewa song tsang an tes che yang ma debi zo rawo tende ke set sunu rawo tende ke chen yang yung yore.
And the reactions I just mentioned of headache, body aches, tiredness, and mild fever, light fever are usually more common after the second shot or the second dose of the vaccine.
The company but the jet service jela snuzoro she de che tsawam parya ina re an tang chenjo ro yin be ina re tigana je 제 소포나이 나랭고 나야로 이빈나레 뜻 참마 찌용게 찌땅게 다 순누도 독진 차게도
If the reactions last longer than 3 days, or you are concerned about more severe reactions like fever that last longer than the 3 days, and Dr. Flores can expand on this, or longer than 24 hours, please call your primary care physician. Or if you don't have a medical provider, please call 311 if you have any additional questions or concerns about reactions or side effects to the vaccine.
tini tandango kapte jat sabi jela je anima khashe jela neta sunu do te deja ge yawa dan tinje kine dan te chung yawa dan te yang anima ma jap jini shukchit je ro yi zo ro je we na an so su chu yu zab je ke na la so su ke ge ke men pa te la to chine khapa tang de wa china ti go re ti ga na je ane tanda ti som chek chek ke thol to chine twa da tin yo na ane tel khapa tang to chine ki ba phu na
And for those of us that are going to get the Pfizer or the Moderna vaccine, even if you've had reactions like the reactions I just mentioned after the first shot, please still get your second dose or your second shot of the vaccine unless your medical provider tells you not to.
Toyep ke ngongo kap tangpo te jat sabi ki jela sunu tinde yunga do sila ne yang kamni pat ma jawa ti tawa ni ne mana ros kamni pat yin chim ni jago go yore ande kasi chite nimi ke an so chu ke tanda te mempa te ke ta ma ja slam ne ma to ke jeba kap tangpo te jat sabi ki jela ane Pfizer Moderna ke kamni pat yin chim ni jaro nang.
So let's talk a little bit now of what can we do once we are fully vaccinated.
당아서 가세 상말로 데 카야 부잡 사비나 당아서 가리는 그리스 라 게데 시에비나.
One, let's celebrate that we are fully vaccinated, and talk about what activities we can do without a face covering or without physical distancing.
당아서 카브로 상마 잡 차든데 제비나 아니 단당아란 수인데라 지소 장기 전에 안도도 제야라 소바탄 카레 공고고 비케네 tanto 소파 메비 키토니 안 아스톤데가 마포 제야 요레스.
Even though we can walk outside without a face covering and perhaps no longer have to do physical distancing while outside, it is still recommended to wear a face covering in indoor spaces, especially spaces where you don't know if it's crowded or if you don't know whether people in that space, in that indoor space, are vaccinated or not.
당아서 캅니 캅 차타마로 또 잡 사비나 다동 알아서 페차잖아 쇼키도 콘타트 솔라 치로란 참찬도 야라 소바데 제비나 아니 카레 인지미 공고했는데 용고 요 마레스 제 임비나 양친 강비 나라 디자위케 감라오 담소 마포 요비켄 참 안라버트 총단제 롭다당 안엔 루주 제바다 라소바든지 kabla yang kare kongko yake ane mboku shuwa na jichin yang kare kongko yake ni tanya chagyo res.
And even if you are vaccinated, it is important that we still need to adhere to the requirements set by businesses, schools, public transportation, and other places.
다 ngogo kap satan jap sabi bina yang tanda kontu shuwa na je ke je lobda tan an songkang la soba tan tiga na je memang ruju kesi ke julang kol an tiga na je sacha jimba tu sola to chine inje mini kare konsho slabi kawla yang kare kongo gres.
And once you are fully vaccinated, you do not have to get tested for COVID-19 unless you have symptoms or COVID-19 symptoms, or your place of work, your school requires it.
ata toyeng mongo ke kamde jap sabi ki je la chitan chirang chitan ro cha cha wina toyeng na san do mundo ke taki tin chi ko ya yo mare yimbe ne yang chirang la yang toyeng na sa dan da wi ke ndaho yo wi ke neta tin de yu yo wa tang an ha ba to chi lobda tang so su le ka cha sa tang tiga na je chi jumse jimba tindile tene chiranya toyem nasa yomi takki chigoris lan rimato chike kap chat thangwa jap sawi ki jela ane takki yang chigo gumare.
And once you are fully vaccinated, you will not need to quarantine after an exposure to someone with COVID-19 unless you develop symptoms.
Antigana je kap chatsan jap sat ndi ki jela chi toyem nasa yo kuma nyamdu lo to kin tundu chungwe ni yang chira ne surka chine to chine di gogu yo mare yimbi na yang chiran la yang chi neta ro tindri yungu yo bi na yang surka chine to ki di go yak ne dan chagres.
And if you develop COVID-19 symptoms, please get tested with the COVID-19 test. And if positive, isolate and keep anyone else from getting infected.
Antigana je chiran ke kapnika jap sabi yimbi inare kap chatan jap sabi inare tadong ya neta tindri thong yo wa tindri yimbi na inchi mi ta ki chi go gre ta ki chene kasi nasa yo wa tindri thong bi na an so so chi ko to chine di go gre te de je yin la me jamba ta tindri nyamdu la mando ba che te ke chim peres.
Before I move to the next slide, it is important to underscore or define what fully vaccinated means.
Da sham tu la nga chu ke toyem na sa ke ngogo kam de chatan jap sabi ki je la ke pin tan ni ba kan de singo mi kol shugin.
Fully vaccinated means 2 weeks after your second dose of Pfizer or Moderna.
Ngogo men kap chat thama jap sare se te kani chi ya go re slavina ane Pfizer da Moderna tin de jaw yawina ane dunta ni ke je ni kam ni ba de jam ni dunta ni ke je ni an ta chiran kap chat na jap sai se lap chogu yores.
And fully vaccinated means 2 weeks after your 1 dose of Johnson & Johnson vaccine.
Tiga na je nga kap chat sang jap sai se lawin bi na re tanda Johnson kap jam ne dunta ni ke je ni an ta chiran nga kap chat sang jap sai se to chin lap den rigo res ke kanda kap tren jam ne sangi ranga kap chat sang jap sai se lawina ane kap te ki ni ba de su na la chempet je la tu te su go yo wa song tan te ta kan rig me viso frustration.
As Yarelix mentioned, this pandemic has impacted every single one of us in many, many ways.
Ta kong tu shiwa na ji ke talu ke ne yam de ke ma po che la kang e chi le ke wa to ne tri yo re.
This pandemic has been stressful on everyone.
Tiga na je ne yam de ke ta ma po che la kala orta chowa ma ti yo re.
And just as we are asking to please take care of your physical health by getting a COVID-19 vaccine,
Ta kari shuya in sila wina ani ngaran su supo detang gang la ne tu biak chi tu la to ge miran ke ngogo ke kamde chat sama to sine jero nang.
we are also making a call to all of us to please also take care of our emotional well-being and mental health.
Tiga na je ta ma po che la sem la kang da te ma po che ge yo wa song san yang che sem kam thoten dan de bi ke tho ne lam tong to lop so jaga la so ba ten ke tho la to chinen da ba che ke tu che to sin yo res ke.
Please know that New York City offers a free access to a counselor 24 hours a day, 7 days a week.
Tiga na je New York tonche ke karim pugo yore se lawina ta sosu ke chek sem kam mate bi ke ne tang tin tri de ge yobi na to so la chek sem su ke lam tong shu tang la so ba tin de ke tholan tu je te ane chu su nyu za bi ton ta chek na la ka du chi pa phu na ante go res.
Services are free to everyone, regardless of age, regardless of immigration status.
Tikin tu je jaya te la lona che chong ke chepa yo mare la andele icha ke ne tang kare imite chepa yo mare thama lola jimi res.
And you can call for yourself or you can call on behalf of a loved one.
De sosu gela kange yona shipa puna ndigo rila tiga na je sosu ko ropa tindi dan sosu ke namu zo ro tindi ta ne shu kumat so la kange tindi chege yo bina tu su ke chap chini shipa pu bina ndigo res.
You can call 888 NYC well, and we'll put the numbers because there's the numbers to it and I don't have them on hand. I was looking for them.
That's same count ke netan de Victoria kanget de yobi na ane shipam pusate GGNYC well se tik tole toxin shipa punande gores.
And you can also text WELL, WELL, to 65173 to ensue a chat with any counselor that's available any time of the day, any day of the week.
Tiga naji ta shipa de tanya ma jong che so tiga chek de chintong de tangbi na an chintong tanya ke jote well se de che an tangsa ke angete nga chek dun som ti tholan chintong tangbi na ane ndeva sor chingo res tiga naji an ta tho rang ni to chine pa so yang deva chebi na yang nyc.gov/nyc well se ti thola ane pebina yang ta tho le ane chutuni zabjela chirang ke semkam de devi ke kange da trawa kar yo wa linde chenye da tindike manato fiu deva chawsere.
And New York State also has a program called New York Project Hope for anyone that lives outside of New York City or the 5 boroughs, although it's also available for New York City residents. And people can call this number 7 days a week from 8 a.m. to 10 p.m. by calling 844-863-9314.
Tanda New York ke ngadi ke legend ke chitula tanda semkam ke thola pito chia dan ropa chia dan lamton chia lopso chia la so patindi ke thola ane semkam chotin ke shija priya la so patindi ke thola ndaba chesate ane ji to som go som che ti thola rest anti thola dava chevi kala tanda ngaso New York ke tande 5 boroughs yorwa otinal yobinre tichlo yobinre kanda so system kan la made wadang kange ro tin yobina ane khabar ta bina ante da papi ke kokon labja ane semso karchi gona to chin chegre esche.
Thank you for this opportunity, and I give the floor to our Dr. Flores. Thank you so much.
Kokal na wala nyata pat to chin na ke ta sham to Dr. Florilla and to chin pugi inste kokop. La so sonam la tetna alo.
Thank you, everyone, and thank you, Angela Soto, as always, who does a wonderful job at getting all the information out. So,
Tuchena, Angela Soto ta ani changmalo khati ne ani krangi go duje ta liya and information pugires.
and thank you to the translator, Yeshi, for doing such a wonderful job.
Any translator Iguri Shirale Tuchenang Shuis.
Okay, we're ready for questions.
Thank you so much for being here, Dr. Flores.
Always.
Tuchenang, Dr. Flores.
So I'll start with a question about a recent update that happened with the vaccines and children.
Any net tingsangi any update ki netam korlaya any sungres.
So the vaccines have recently been made available for children between the ages of 12 and 17. Could you share any updates or any new information regarding vaccination with children?
Yes, I will. Let me start by saying that it is extremely important to get our kids back to school and back to their routines in life.
Ani pu lojungi ni chuktin paruge vaccine di tholaya ani di koten toya di be gechambures labrador resta majiten.
Children and teenagers have had an isolation that has limited their education.
Puta an mi kemba paruluya yang isolation di ngazukangi pechimbuteores.
It has limited their social development.
데리야 강이 아니 부부 살롱 지야다 디렉 톨이야 아니 강이 체요레스.
And we have seen regression in development or their development stopping in many cases.
네다 망부치기 톨이야 아니 롭중기 톨이네 레베 부기 아니 살롱 찰톱기 톨이야 강이 망부치 먼저 통비요레스.
We've seen much more concern and need for mental health services in children and adolescents.
이실라인다. 이실라.
We've seen,
Can you repeat again, please?
yeah, sure. We've seen more need for counseling and mental health services in children and adolescents with this pandemic.
Tadang aso te nayam di ke kabla ta chiba inare yonche inare mamampo chegla ane semkam thoti kola koto shukche bope ko yowa ke netan to chagdo.
One of the best ways to bring people back and bring them back to school and to work is to get them fully vaccinated.
네다 약속이 직톨이야스 아니 미창마 루루 전에 파 랍다 이내에 가와 있는 도야기 톨이야 아니 된다 두비알라 vaccinated 캅딩고 캅딩 차장겨 보고요레스.
So far, we have vaccines from age 12 to 17.
단다 버도 먼저 보고 로 중니네 쭉뒤 버들라 아니 뭔고 캅 두고요레스.
We do not have vaccines available yet for those under 12 years of age.
단다 버도 먼저 보고 로 중니기 난쿨이야 아니 캅 두고요 말레스 단다 캅요 말레스.
And the only vaccine that is available to date is the Pfizer vaccine requiring 2 doses.
단다 버들이야 먼저 캅 이어바디 아니 Pfizer 다 Moderna 디 아니 뭔고 캅 탱마 닝이 겨 보고요레스.
So pu to ke chitla.
It's important to know that there is no vaccine that has no side effects. Every vaccine has some side effects.
Okay.
뭔가 전술 side effect 요 말에서 매바 디 실라 규르나.
Tada keche chuche karres la na kap kare be ne yang sedi fe mewa tindi yo mare.
Most of the side effects, as Ms. Soto said, are within a few days and are very limited.
Ta cheyon ke side effect la dita sunu la ku tanda solo no pa ko ya ro te. Sunu do te che ni ma kashi che la de ya ro da tindi kin da che res.
But we have a system of vigilance or observation through our public health system in the United States that's very, very thorough.
Sunala.
Does that help?
Go ahead. Sunala.
이실라 성다.
Okay, I'll say it differently. Through our public health system, we're very careful with these vaccines to report any reactions.
아주 단대 내 시스템 나로야 아니 뭔고기 캅게 거기 디 시스템라 빼마시바 아니 게 첨부치네 도난 첨부치네 남기스.
So even small numbers are reported and evaluated.
마세 아니 number 장제 뉴뉴치리나 양 아주 report 남기요레스.
With the Pfizer vaccine, there have been some reports of complications, very few, maybe 1 to 2 in 100,000.
Pfizer gi khap in yishla gyuran
The Pfizer che ki ngo me kap te jawi kala che kange do da nyu do te lag yo wa te khashi che yu do ma po che mare me jak na ni chingni te che ke ta che kap te jan nga dri chong so che ke tu tine sola tu tine thong te ni da kala ta ni ju jawi ren re thong ku chi na re ka da ko so la ne ba che ke do.
It has been reported in young boys ages 16 through early 20s.
Tigana yete ke chidang ke dawa chinye ro de sure ya slawi na ane lo chudo ni lo nyusho sina mazin la ke chiba to su ke regla an test yang kangero yungu yobi ke call to sin la kudu.
That there have been reports of something called a myocarditis or an inflammation of the heart.
O tengin ko chiba suna la ida.
Inflammation of the heart, of the muscles of the heart.
De kanye di muscle ta nying le ya ni test kanye yo ba chik kor la ya chungyo res.
It has occurred in these young men after being, in the small number of young men after being vaccinated with the Pfizer vaccine.
De ani tangpol nyu chik ma to ke chungyo ma res mi shushen ti le ya. Chik
There is still no proof that it is related to the vaccine.
and de ya ani proof tende ka yo ma res di ngongo khap ni chumbati.
This is still under observation.
Di thandu ine ani takje chishin ba res.
These reactions occur 1 to 2 days after the vaccination.
Di nenzu di nima chik ni paru le yung yo res.
So it's important that if you have a young man vaccinated with Pfizer vaccine and he has symptoms of chest pain or fatigue, that he be seen by a doctor.
Ishila.
Teni tanda ke che karis la na ya che pu kin ko ro teni khap jap sawi ke je la tanda nyeng ke tanda shagu la so ban de la na zo ro tu tong gu yobi na ya te doctor la tin ko res.
Sometimes these reactions occur with every virus or any virus.
Ane can you repeat?
These reactions can occur with any virus, including COVID.
Chitang ke tanda ti ke chik su nu zo ro tu so chasan lo te ane makeup chama lo ko yong chowa ro ti che tang la ba de to yum nya cha ke tanda go kham te ke kara yong go ro ni chago res.
The CDC is in an observation period looking at these cases.
So no like that.
O CDC ki thandu ine di neyom di ki thole khap di neyom di ki thole ya ani sida si shimbares thandu takje nangi ores.
By this Friday, we should have a lot more information.
Ani thandu yongyu sapa sang nimalaya ani ngaju yangyo ani nenju sawa mangbu khen tu gres.
But please remember, these are very, very small. These cases occur very rarely, and we're not sure if it's associated with the vaccine.
Nenju dinde test na cha effect yongya la sopa di inji minji khap ngongo khap di yimba ke khap ge yo mares ani shicha she shita gi nyunyu res di.
It is still recommended that young people 12 years and over be vaccinated with the Pfizer vaccine.
Ani di ke chimbu res pu lo chungni ne chuptu padu paru ya khap ngongo khap ge di pe ke chimbu res pyoro nangs Pfizer da Moderna.
Thank you. No Moderna, not Moderna, only Pfizer. Moderna is not, Moderna is not available to children 12 to 17 years of age.
Moderna di pugulo chungni ni chupten la parula yo mares ani Pfizer chipo yins.
The good news is that we will probably have more vaccines for children and adolescents by other companies in the near future.
Maumbalaya ani ngajo nenju sanga chilaya ani khap mangbu thungi res puguta tende tholaya ngongo khap mangbu thungi res.
Thank you.
Tuji chena.
Thank you, Dr. Flores.
Tuji chena, Dr. Flores.
Katichena. Long explanation.
도지체나.
Sorry.
고맙다.
Yeshi, do you have your hand raised?
Yes. So should I speak briefly in Tibetan again?
Yeah, go ahead.
Sure.
Yeah. I try to figure out briefly and easily to catch. Right, dear listener. The terrain also New York Trotin Le Conta to check Trotin Le Conte Gananchi and New York TGP World Endangered Language Alliance, the Gananchi New York, New Jersey for Institute of Tumok to Nitoxin, Koresh Tupike, Togi Mogo, Juguke, make up and Trevike Tolatoxine, Tanda Donanda, Tamchi Toxin, now so to Samalote to chest in Shuata, and Tedanyamdula Taje that Taton Toxin Chivikala, Yankee. Sela mese visoro tindi check da qual sabo quala mugo visoro tindi toni ate tese che pni tampi na ate danga tu joni de cheparo de tes chinyobina dan dordu shuwina and da new yol dijanye ke machathan lo te la to yeb na ta ke ngogo ke khapte jaya ke tunji yore reg da ru da po da mo lo na ke jong chepar yo mares wa tiga na je tanda khapte chathan lo te rimi ke to kine jaga yore Jagsati Sosunyan Koda Yeyon Kasakala Tuji Toxin Tujayore, Kap Jaro Nanski, and Kap Tampo the Japsavi Jela Kamnipa in Yapa to Jagokri Jaro Nanski, Antigana Jet and the Chipa Lochuni Sinjo Ki Inchu, the Chatan Lotil Toxin Kap Jagayore, and in Yapa to Kap Jagaki Japanarona, Kap the Javi Nasul Pengoris Lina, Soso Gala Pempa Tamazi, and Sosu Yeyon the Sosunyan Ko Pechagana. Zupun choten ke neba ko thoni yang go ke khap jam cho bi ke rei ta labar to lo chungi ko lepten jo ki pa to so ta khap jagi me wa song ta to so changma lo ke denja den jawa yu de ko yo wa song ta ani ta da ngaran so khap jagi ke ko kap ten tuje yu de bi ke rei so chatan lo ke khap ten ni pa to jaro na te changma lo ke khap jawi na ani tongche new yo ina re new yo nga de ina re arin chong yo ina re zamblen chong yo ina be ina re ani to yem na ta ti jun chi ne an ngaranso marjuna jiki tokchine niyake tuje tokchine chagi yore tenda yamba sonsan kap jagate soyen che mana ro che kapi ni ba to ane jaro na ane kasi sosu jig jam jagala pe mato bi ne dan tende yobi ne yang taji kontu shuba na jik shipang ran tu tola shipa phubi na ane kap nang lo chot jakala tokchine tuje jagi yore Antene yamba songsan ta ngaso ari kinal deni yamba songsan tabi ki kokap yapo shiu chek dan tuje yapo shiu chek to sin cha de yamba songsan an tuje da kokap de so langbi ke thoni chezon chong yu shede dan chezon chong yu na ta ki kange te mewa chaga ki to la an chami kaping yamba to to kin jaro nang se de resha tate taji kont shiu ke ning du ro ti an do shiu na tendo sreja an tren thama tilata da New York to check and totally content the energy doctor Florida Koni ke to sine kapte kani jago yowata kaduja chogo yowata solo ja chogo yowata odi kutola to sine koto priande tren mixe ke sanindel yu david ke ane popa surang ki chitula to sine kore na wa songsa ane nya tabani to sine sine shua ta popa so ke to sine kap jaga de soye chunu mata ho chene rangjin ro from chatan lo ke denja ki to lan ka pingi patu jaro na skin shui to chena
Thank you.
Thank you,
sorry
Yeshi.
you don't understand I try a lot
But I'd say thank you anyway, because I know you're doing well. I do want to say something about long-term reactions.
Sure.
And it's a
long-term reaction ki Korea sungis.
It's important to talk about this because that's something that worries people about themselves getting a vaccine and giving the vaccine to their children.
Di kechembores mi mangbu semre nangi yores kapul kapke ta susor kapseya ta dire sami tolia ani semre nangi yores di tende res anti korla sungis.
There are many things that we still have to learn about the COVID vaccines.
De energy mangbu jing aju tandu jang da jang shibares.
But we have a lot of information on how vaccines work in general.
안 지당기 ngajungongo khap ki korlia information yonda yongshimbares.
And if you look at the common vaccines that we take or give our children,
Ay isloinda.
손대 없어 손대
of the vaccines that we take or we give to our children,
자인다
Uji isla. Sung
okay,
his turn.
his turn. All right, go
Ah.
ahead.
no it's her turn.
Go, Yeshi, somebody go.
Okay tell me.
Of the vaccines that we take or we give to our children routinely,
tanda 줄 갑자와디 자산로 또 전에 tanga 주자와 난지 지는 알아 주
like vaccines for diphtheria, pertussis, polio.
제가 또 영국 갑자기 많이 비제 남중 알아 주게 다 중종감이 감만 보지 자거래 소수 전부 저우가라 소수 불레 갑도 타만로도 자주고요.
We find that that the reactions happen within a few days or a few months, not a few years.
제가 나지 갑도서 타만로도 알아서 다자 알아서 불라 자도 제대기와 손산에 갑게지 다 수누조로 다 테스체 칼로
So
남조와로 테 안에 니마카시 제다들이 나카시조로 든지질 찬지마도 체게 로마볼 트리케스 용마레스.
So it is very unlikely
네 집에 단들이 차가 되 용용로스레스.
that the COVID vaccine would have any reactions for years after you receive it.
다다 로마보 체게 제라 또였나 사케 뭐 갑자기 그 리액션으로 가르치기 염이때 지단진 다시 좀 마테우스로 제레데 이내야 파제 안트리시다 인고 말레스.
Reactions occur within the first few days, first few months, pretty much not later on, years later.
다다가 주제 나라다 갑자기 잡사베기 제라 제 주도 같이 제더니 막 같이 제가 찬리마도 제게 드니지 로마보 제게 제라 드니지 슈케로 같은 게 매비게 초바치기 그래서.
Okay,
Thanks, Dr. Flores.
thank you.
All right, and so before we move to close the conversation, are there any questions that you've received, Sonam or Yeshi, from your community that you'd like to ask?
손음 저발라 입에
No, I don't have a question. Thank you.
Okay.
Do you find people are interested in being vaccinated and completing their vaccinations?
Yes, of course.
Very good. And I do want to say one thing about what Angela said, and she said it very well, that people need to take that second vaccine dose for the Pfizer and the Moderna.
Yeah, Angela gisungu yores and cup Pfizer the Moderna gi dose niva dinji michi kyoro nangs.
One dose does not give you sufficient protection against this virus.
Ani dose thangbo digi ani ngongo na neshi cup ngongo di kyap thupi mare estigas.
Only with Johnson & Johnson can you get away with one dose. With Pfizer and Moderna, you must take 2 doses to be able to be protected against COVID.
Moderna the Pfizer di thingmani ni kya yores and Johnson thingmachik kya di Johnson & Johnson ani Johnson se di chikores kap thingmachik kya.
Having people fully vaccinated is the only way we're going to continue to be able to combat the COVID pandemic.
아니 갑차장 갭투기 갭투바 찍볼이 아니 디네시 나자원고 디 갭투기레스 치로 백용야래야.
And just because there are a lot of people around us that are vaccinated, that doesn't mean that we shouldn't get vaccinated.
이슬라인다.
Can you say that?
긴 이슬라.
Because there are a lot of people vaccinated that doesn't mean that we should not get vaccinated.
tanda ngaran su yin lo yobi ke pe chewa te ke kap jab ya wa song zan ta ma chama kap jab cha wa song zan nga kap ja go gu mare se tende mare me jamba ke kap ja go so ju ke kap ja go gu yore
We have a variant. We have variants. The vaccine is changing, and we have variants that are very dangerous.
karchin re se la ina tanda na cha te ke ngo ro te juan ro ge yung go wa song zan te pe ni ka chenbo re tende yamba song zan an nga chu ke kap te yang to chene na cha te la pa pi ke kap to sun juan ro ge wa song zan ane yin che mni kap te ja go re
And the longer you are not vaccinated, the more likely it is that you can pick up one of the variants that are very dangerous.
tanda kama jab to chine debi yimbi na ane kap ke na cha te ke ngo te juan ram dan ro ne to chine shanok ke na cha to la tes ngo ma da wa tende yo wa song zan tende ke na cha che so so la le bi na ane pe ni ka chen bo cha gre
The way to stop the variants, the way to stop the pandemic is for you and your family to get vaccinated as soon as you can.
ta tanda kap ke ngo te jo ma pon ro de wa ten sam jo yung ya ta lag bar te ane to tanda te nayam ten sam jo yung ya ke chi to la ke che hu te ane so chu ke kap ta ma tan chan jap sa wa che te re
I hope that this information helps you make your decisions.
nge ke rewa na la tren ke ngaran tu kamu shuwa de da ane tu so ke chana kap ja ya ke thak yu to bia la so ba tende ke ane pinto chembu ya ke rewa che ge yos
And lastly, if there is an unvaccinated person in your family that gets sick, don't stay home, call 311. We do have treatments in the hospital for you.
tama te la ta so su ke na to chine kap ma ja bi so ro tende me yo wa ta tende ne pa cha wa da tende chong yo bi na ane ngem par te ane som chek chek ke thola khapar ta ne rewa che go re tende tang nyom la ja ge yo ma re
Thank you.
so chena
Thank you,
Thank you.
Alex.
Yeah, thank you so much, Dr. Flores. So I'll move to end the meeting.
Mhm.
Thank you all so much for being here and for participating.
Could you announce Dr. Flores dari dirpeba and then mata move nangis.
Yeah, thank you so much to our presenters and thank
Thank you,
you of course,
Angela.
to our interpreters. I hope you all have a great night.
Be well. Bye-bye.
Thank
bye
you.
bye
Thank you.
you
Bye.
Bye, Alex.
Bye.
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 Thanks.